Good afternoon, Judiciary Committee and co-chairs Gary Winfield and Stephen Staffstrom. My name is Colleen Wilcox and I live in Trumbull. I'm a registered nurse and a student family nurse practitioner. I oppose House Bill 6425, which allows for physician-assisted suicide or PAS, whereby a provider can prescribe a lethal dose of medication for a terminally ill patient to self-administer. Although this bill has recently stalled, I heard Senator Winfield state in an interview that this bill is not done, that we can count on it coming back. So I'm here to ensure that my testimony in opposition to this bill is heard and on record, as it is clear we will see it again. I stand here today fully understanding the seriousness of a terminal diagnosis. As a teenager, I witnessed my mom fight against cancer for 6 years. She fought extremely hard and battled back-to-back cancer diagnoses, but she passed away 8 years ago. Having seen one of the people that I love most face a terminal diagnosis, and after being by her side through the end, I take all matters that relate to dying with dignity very seriously. I actually thought I would be here today supporting this bill, but after thorough research, I found that there are far more risks and concerns that outweigh any benefit, concerns that were serious enough to change my stance on this bill. For instance, the bill does not require that patients receive psychological counseling before choosing to end their life. In Oregon, since 1997, only 5% of all assisted suicide cases have been referred for psych evaluation. This is so unsettling because it's impossible to know if a patient is choosing to take the lethal medication based on sound judgment or if it was motivated by emotional distress. It has been determined that terminally ill patients with cancer request assisted suicide 7 times more when they're depressed, and up to half of all patients who once seriously considered it change their minds when they receive psychological support. As a student of Quinnipiac University, where the holistic model of health is taught, I cannot support a bill that doesn't address the full patient, not just the physical health, but their mental and emotional needs. Another alarming statistic is that 46% of patients in Oregon changed their mind about wanting assisted suicide when given substantive palliative care instead. In other words, when appropriate end-of-life care was given, almost half of all patients no longer wanted PAS. So the first issue to address is providing proper end-of-life care, not jumping to legalizing assisted suicide. As a soon-to-be FNP, I have to look at the entire family unit as my patient, and I urge you to do the same. A study found that PTSD and depression were present in 20% of relatives of people who died from assisted suicide. So this bill can affect more than just the patients who choose that option. A different study found that in areas where assisted suicide has been legalized, there has also been a marked increase in overall suicide rates in the general population. Are you willing to take the risk that legalizing assisted suicide in Connecticut will lead to more people taking their own lives in other ways? Proponents of this bill will argue that patients should have the right to end their physical suffering and pain. But Oregon data shows us that only a quarter of people who chose PAS did that due to fear of inadequate pain control. 45% fear being a burden on family, 74% fear loss of dignity, and 90% fear being less able to engage in their life events. When so many of the reasons for choosing assisted suicide are not physical issues, but emotional, mental, and spiritual ones, it would be irresponsible to pass this bill when there is no requirement for patients to receive psychological counseling first. So, I urge you to please consider the many other ways that residents of Connecticut can be supported when faced with a terminal diagnosis without needing physician-assisted suicide and all of the risks that come with it. Please continue to oppose Bill 6425. Thank you.